Welcome back to our Senior Power Community Channel. This is Joel, one of the senior advisors on this channel. And I want to mention that, as we may have talked about in the past, our work is all powered by artificial intelligence, and it has made a great difference in how these podcasts have been put together and the speed at which it has occurred. Today we're going to be discussing how one might approach making choices in Medicare, because there are two major plans. One is called usually Original Medicare, and the other is called Medicare Advantage. There are some others, but they are so specialized that it doesn't pay to discuss it here. We can discuss them offline with anybody who really wants to know. So anyway, the message will be here very strongly that you should think long and hard about your choice in this area. It affects your quality of life, and it affects, through that, your care. So let's walk through this together. Let's now go through the agenda. We're going to begin by giving a quick review of this Senior Power Community Channel in terms of the purpose and methodology that is relevant. And then we'll talk about a brief history of Medicare, which builds upon the information provided in a previous episode of the series, which discussed the basics of Medicare. And then we're going to look at the overview of the pluses and minuses for each of the two plans, what they give and what they don't, and what you should be very wary of. And this involves the analysis of some depth into the programs. We want to have the opportunity to make sure that you have the right level of validatable information upon which to make your informed decisions. And then we'll discuss what episode or episodes come after this and go through a question and answer period, which is very important to us because we get firsthand feedback. And please remember to subscribe and like us and all those nice things. So let's begin our review. And I'd like to begin that process by looking at how AI has boosted our ability to do research and analysis. And what this particular box is showing is that each step is very carefully controlled. Much of the research is actually performed by AI using such tools as ChatGPT and Genesis from Google. And we go ahead, we do a filtering of all this, and in the end, we come out as a result, hopefully a better quality, a way better quality of life, and the ability to make informed decisions on which way to go. For example, which of the Medicare type plans do you want to choose from based upon information that is actually and absolutely validatable. Okay, so what is Medicare? We had said in the previous podcast, it's a multi-part federal health insurance program. You can certainly read through this yourself, basically for seniors, with some exceptions, and basically covers almost everything except permanent kidney failure. And the word covers I shouldn't even have used because that gives a wrong impression. It addresses each one of those. And then that there are 4 parts to Medicare, and there is also within that a Part C, which is for Medicare Advantage. So we have original Medicare parts, which you are entitled to, um, but also there is this advanced um, service that you can sign up for called Medicare Part C or Medicare Advantage. And for certain people, it is indeed an advantage. As previously discussed, there are these types of Medicare. And when you first enroll in Medicare, which is only can be done at certain times of the year, which is an so-called open enrollment period, usually in November and December, you can choose how you get your Medicare coverage. You don't have to choose if you're going to continue with the coverage you already have. And there are three ways. Okay, two plans, but three ways. The first is the original Medicare, which includes parts A and B. And then you can get Medicare with supplements, because the original Medicare does not pay for everything. And you could be left with a considerable bill if you don't try to plug the holes. And then we have the Medicare Advantage plan, which is like original Medicare, but with additions to it, supplements in essence to it. And there are several plans for that, and this is where you have to make your decision. Let's now go through some detail in the comparison of the Medicare types. And I'm actually going to sort of read this to you, make sure that we get all the points across correctly. Okay. The first is the provider and hospital choice that you will get in each of these selections. In original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. And that sounds great. However, let's keep in mind that a significant number of doctors, one, never have taken Medicare, and number two, more and more of these doctors, and even in some cases, hospitals, are withdrawing from the program. So remember that. In most cases, in terms of Medicare Advantage, yes, you can only use doctors and other providers who are in the network, except, of course, in emergency situations, the rules are different. You can use anyone. You have to remember that these doctors are sewn up in this network, and for the most part will be available at least through the year of this particular Medicare enrollment. And in original Medicare, yes, you don't need a referral to see a specialist. That is true. However, again, specialists in particular are less and less likely as time goes on to be providing original Medicare service to their patients. And in Medicare Advantage, definitely you may need to get a referral to see a specialist. However, in areas like behavioral health, you do not need one, and it seems to be a trend now that in general you may need less and less to get a referral to see a specialist. Okay, how about coverage, right? The famous word coverage. Coverage means that something is included within each of these plans, Advantage and Original. But it's not full coverage. Right? The word is very loosely used. Well, let's go down line by line here. Original Medicare covers most medically necessary services and hospital supplies and doctor's offices and other healthcare facilities. However, original Medicare does not cover such benefits like eye exams, most dental care, and routine exams. It will, however, cover dental, if that is part of a disease that you're having that has been affected by other areas, or you've been in God forbid, in an auto accident and you've been injured in your mouth area. Medicare Advantage, well, truth is that plans must cover all medically necessary services that original Medicare provides. I'd never use the word provides than covers. And in addition, the plan offers additional benefits that you don't necessarily have to pay for: vision, hearing, and full dental services. Okay. With original Medicare, you should get drug coverage, and this is done through a separate plan which you have to pay for. Okay, think about it. Remember that. For Medicare Advantage, Medicare drug coverage is included, and it is a real savings. Again, I don't want to prejudice this, but the truth is the truth. Okay, and so you cannot join a separate Medicare drug plan because you already have it. In most cases, for original Medicare, you don't have to get a service or supply approved ahead of time, but in Medicare Advantage, because it's more controlled, you have to get a service or supply approved ahead of time with a plan to cover it. And again, depending upon your plan and the insurance company, usually there's not much of an issue. Continuing on, Medicare Advantage and original Medicare. For Part B covered services, which is the doctor's services, usually pay 20% of the Medicare approved amount. So, for example, if you're going in for a examination, general examination, could be $200. You would have to come up with $40 of that, or get what is called the supplement, which we will get into. For Medicare Advantage, it varies, but it's usually much lower than that. And for the most part, when you come in for routine visits, you don't pay anything at all, because it's in the insurance company's favor to keep you healthy. So they will pay for They will pay for wellness services, so to speak. Okay. You pay a premium for, which is the monthly part of Part B, if you join the Medicare drug plan, and you will pay a separate premium. When you do the normal Medicare Advantage, you will, of course, pay the premium in some cases, but in a lot of cases there is no premium, and they will help you pay for all of Part B, which helps you pay for all of Part B premium. I'm in a plan like that, and aside from the money that is taken out every month for Part A, I don't pay anything else. And most of these plans, as we mentioned before, include the Medicare drug coverage. Okay, there's no yearly limit on what you have to pay should you have Medicare, original Medicare. That's a big statement. You could, unless you have supplemental insurance, which is an additional charge, there's no limit which can be placed on the amount of money that you will spend in taking care of yourself. However, on Medicare Advantage, there is a yearly limit. And this yearly limit varies by the subscription period. It's been pretty stable. And once you reach that limit, which is could be $3,000 to $5,000 for the year, everything else is taken care of. You'll pay nothing for Part A and Part B services for the rest of the year. However, some of the problems are taken away with if you get the Medigap insurance or supplemental insurance for original Medicare. And remember, this is not an inexpensive thing, and its costs can vary upon your health conditions. And you cannot buy such a plan under Medicare Advantage because basically you don't need one. Okay, let's do some analysis of what we just said. So let's analyze Medicare, original Medicare versus Medicare Advantage. And we're going to be using 4 evaluation criteria. You may have others, you may want to apply it, you may want to let us know about it. First is the choosing of a doctor or a hospital. And then what coverage are you going to get? What happens when you travel abroad? And then when you add up everything, what is the overall cost to you? So which is better? It's a very, very personal experience. I'm sorry to give an answer like that, but it is so complex. Okay, and we can help you offline. You can give us a call. We can try to help you with some of this and see how we do. But it's based on such factors as how flexible are you in terms of meeting or working with a particular hospital system or provider, and whether you are interested in having a cap on annual expenses. Okay, and whether or not you want these additional benefits. Okay, it's all up to you, and even how much you travel, because there are some restrictions for international travel and even some times within the states. Bottom line, no one size fits all. You must consider the relative pros and cons of each type, and you must make your decisions based upon truly actionable information. That is so important. You have to know what is the truth that people are giving you regarding the pluses and the minuses for each one of these plans. Continuing in this comparison, please note that the number of Medicare beneficiaries enrolled in Medicare Advantage has basically doubled since 2007, and there's no sign of slowing down. And I believe it's cost figure that might be doing it. And there are more and more types of plans, choices within Medicare Advantage than there was any year in the past 14 years. Okay. But is one plan truly better? The original Medicare is a fee-for-service program that consists only of 2 parts that comes from the government that you're entitled to. Part A, the hospital insurance, and Part B, the medical insurance. Medicare Advantage has to cover by law the same services as we just mentioned for original Medicare, but other benefits are included, and it even includes at times the transportation benefit to take you back and forth to your provider. That's an interesting thing. So the findings for original Medicare. Medicare Part A covers the inpatient care for hospitals, skilled nursing facility, hospice care, and some very, very limited home health care services. And most people do not pay a premium for Part A as long as they or their spouse have paid enough Medicare taxes during the course of their careers. Most people fall into that. Medicare Part B, which is again part of original Medicare, covers all the outpatient care, preventive services, medical supplies, and other types of doctor services, but it does require you to pay $164.90 as a monthly premium by law. And then there is a deductible after that, whereby it will not pay for anything until you take of your own money $226 being spent. And you must purchase for Part D a prescription drug plan if you want prescription coverage. So the average, and note that the Part D premiums for the drugs are rising, and now they're rising at an almost scary rate. Okay. And then we have the Medigap, which fills it in. Okay, if you don't want to pay all that out of your pocket, so you pay this Medigap insurance or supplemental insurance every month. And, you know, if you have a Medicare Advantage plan, you can't get a Medigap insurance. The Medigap policies are standardized, that every single plan must offer the same benefits. However, interestingly, depending upon the company you're using for your insurance, they can vary. The cost can vary and can be much more expensive. Okay? So remember that. And if you're missing up on getting the Medigap insurance, you're going to have additional problems. Now let's take a look at Medicare Advantage. Medicare Advantage plans, as we said many times, and I want to keep repeating it because there's a lot to remember here. All the services in the original Medicare are addressed, and then there are additional benefits. All these Medicare Advantage plans has a provider network. And you can even sometimes get a plan, I've seen, where you're not trapped by the network. You can go outside if you're willing to pay a difference. So 93% back in 23, the last available information, most of the plans that are available were either of an HMO type, where you select with your physician is in a network, or a PPO plan, personal provider organization. We will get into that as well. Okay. So you'll need to see in-network doctors and specialists, or you'll pay a lot less to do so as a PPO than their normal amount. Yeah, I know, it's complicated. Medicare Advantage plans usually don't carry any premium. So if you have Medicare Advantage, you get all these benefits, apparently, but you're paying nothing more for Part B. So therefore, on the whole, although one should never make an absolute statement, it appears that there is lower out-of-pocket costs relative to original Medicare. However, this is again something which is on a personal basis and depends upon your health, a lot of different factors. And the Medicare plans are required to give you a cap at $8,300 for original. That's the requirement, but a lot is much lower in terms of your out-of-pocket amount. Let's talk a little bit about the next episode, which we call MD versus DO versus DC. This is what we call the Medicare supermarket, because there are so many different types of providers, and we want to be able to discuss what these providers are in the next episode, so that you get an idea of what you're buying here. And again, nothing about this is simple. Okay. We'd love you to like and subscribe us. Please do, it's important to us. I think you could say a lot of work has gone into this, particularly on the graphics, and we try to make this as clear as possible. So we'll see you on the next episode, and until then, everybody take care of themselves.